Okay, we are back. And so I'm not going to belabor the point too much. I'm going to give a quick take on things. I'm going to open the floor to discussions. And because, um, again, what's sorely missing from this take on things is really an aggressive lifestyle approach. And here's a patient who's had long-standing disease, and I alluded to it very early on. That her disease probably started in her 20s and 30s. This is not an overnight phenomenon. And so her condition is not due to a deficiency of colostopol or a deficiency of atorvastatin or the like. It's a metabolic disease that's related to what she's doing inside of her body. And so what I want to do is kind of give my take on what I would do with this patient in the setting of peripheral arterial disease. But before I go on, I want to, again, welcome you all to Fresh Natural Live. Give us a thumbs up if you haven't had a chance to. I know some of you have. Show us some love in the chat. But if you listen to the recording, also give us a thumbs up, because I think this is information that should be shared with the audience. And if you haven't had a time to subscribe, please subscribe and hit the notification bell so you can get notification on future important presentations like this. And of course, share it with anyone who you think will benefit. So long story short, this person needs to be started on an aggressive lifestyle intervention. So she comes into the office with this presentation, the symptoms, the history of coronary disease, etc. On day one, I'd immediately do an extensive number of tests. I would check her ABI. We would also check inflammatory markers for blood. I'll check ultrasensitive troponin and the like. And so we would do all of these things. I would sit down with her and tell her, point blank, you're young, you're 61 years young. However, you're at risk for having your legs chopped off and having another heart attack. I'll be just that blunt. And we need to make changes right away. This is a 911 situation in my standpoint. And the 911 situation is one from a lifestyle intervention. So with this patient, we would do a battery of tests off the start. I would simply convey to her the importance of making aggressive lifestyle changes. And then I would talk to her about the approaches we use, how we can work with her, and the intensity of the therapy that she's going to need. So, and let's assume that she's amenable to that. Then we would schedule her for a follow-up appointment in just 1 or 2 weeks. I wouldn't say take this drug and come back in 3 months. No. She comes back in our integrated care clinic. We would then have her sample the detox food. We would talk to her about sauna therapy, about BEMA therapy. We'll talk about time-restricted eating, and all of the things that we need to correct her metabolic condition. And we would follow these metabolic biomarkers that we follow in all of our patients like this. Now, if she gets on the program, when she starts the detox, we'll then see her every week, if not sooner. If she's in the sauna therapy, our sauna patients start infrared sauna. They do 5 days a week, so Monday through Friday, etc. And during this time, we typically see changes in blood pressure. I would expect her claudication to start improving within 2 to 3 weeks. The ABI would probably improve in maybe 3 to 4 weeks, if not sooner. And we would mark those changes, and we would point those changes out to the patient. And we would continue to carry her through. Instead of increasing her statin drug, we would show the reduction in her lipids and reduction in inflammation, and then we would reduce the statin drugs. And I've had patients who are bad smokers, who also are alcoholics. And when we put them on a nutritional detox regimen, we find that they actually are able to stop drinking and smoking fairly easily. And so we remove other toxins from the system. The body becomes less tolerant of other kinds of toxins, such as alcohol and cigarettes. Now, I'm not going to go out on a limb and say, hey, detox causes smoking cessation or rids one of alcoholism. We haven't done those studies. I'm just saying these are my observations. But I mentioned that in the setting of this patient smoking, yes, I'll tell her to stop smoking, but I'll really emphasize the food that she eats, or more importantly, the cessation of the food she should not eat, i.e. processed carbohydrates, process other types of foods, cooked foods, animal protein, or dead animal flesh, as I call it. So we really put an emphasis on the removal and the nutrition of how the body's nourished first and foremost, and try to get her to make these improvements. If she's able to make these improvements over a period of 4 weeks, we're able to get a stronghold into her mind, her psyche, her taste buds, and she starts to see improvement, then I think it's going to help us a long way down. It doesn't mean she's going to be perfect all the time, but I think in the first 4 weeks, we can make a strong impact on her success and how well she's feeling, how well she's doing. Plus, we're able to wean some medications. We find that these patients start to do well. So I have a completely different approach than what's described in this review article. And I think it's important because what they said is that you want to, reduce overall cardiovascular morbidity, mortality. And the best way to do that is for the optimal nutritional intervention. Infrared sauna therapy does that. It works for peripheral arterial disease as well as coronary disease, and BEMA therapy works as well. In addition to the diet, we may give supplements on a targeted basis. Frequent people are vitamin D deficient, and we may supplement vitamin D as well. So I'm just going to give that little take. I think I probably talked too long. Let me open the floor to my colleagues and get your take on things. I know Dr. Floyd has a lot to say. He's seen a lot of these people with peripheral arterial disease. So whoever wants to take the floor next. If y'all see any questions that I've overlooked, let me know.
Okay, I'll say something here. Just from the practice of podiatric medicine, I mean, you really covered everything in detail, what needs to be done. One thing we look for, you do the diagnostic screening, but we're always looking for it at the earliest signs of the disease changes. So a lot of clinical evaluation we do to also look at things. And we share these with patients because I want patients to be proactive about their health, because when it comes to peripheral vascular disease, it's all about prevention or reducing the disease process, because it is a slow chronic disease that develops that way. But I instruct patients of doing things like you look at your fingers and toes, but one thing we look at is a capillary filling time. So by pressing on your nails, and you can count and see how many seconds it takes when you're pressing your nails, it'll turn white. And within 2 seconds, you want your nail to turn pink again. If it takes 5 to 10 seconds for those nails to turn pink, then that's a problem with reduced circulation to those areas. And then number 2, you always want to look at the hair. I have some patients come in and say, well, I have hair on my toes and I don't want hair on my toes. And I'm saying hair on your toes is a sign of excellent circulation to your skin. When you lose the hair on the top of your toes, or even the hair on your hands, if you have hair on your phalanges and your proximal to your distal to your knuckles, that's a sign that you have good circulation in those areas. And so we look for hair loss. Hair loss is a big sign that circulation is starting to decrease. And those are things you can see in the 30s and 40s and 50s early. As a sign of decreased circulation. So that might be a risk for diabetes. When you see those things, some cardiovascular issues are probably going on also. So we want to really check those things. That way, when you can screen, but when you start getting abnormal tests, you know that you're already crossed the mark of intervention. And intervention process is tough, because when you're doing the revascularization, is more, I call it, that's a 911 call. That's a Hail Mary in a lot of instances, because trying to reverse those symptoms are very difficult. There are, especially with patients who experience diabetes and symptoms of diabetes, we want to do their nutritional supplements you can take that will help improve that, like the alpha lipoic acid. We recommend people take anywhere from 600 to 800 milligrams of alpha lipoic acid, up to 2 times a day. Because what that is a strong vasodilator. Opens up blood vessels and increase that blood flow, because the oxygen is a problem. The signs you mentioned earlier from the paper, the intermittent claudication, where you have pain, you walk 10 minutes, you have pain in your legs, you have to take a rest, the pain goes away, you try to walk again, pain comes back. Pain is always a sign on exertion, as you mentioned, is a big problem. So you want to address that also. But again, in the paper, I think we should, and you mentioned it in your summation, that the diet and nutrition really needs to go first. You have to change those things. You have to stop drinking alcohol. When it comes to the smoking, nicotine itself is a strong vasoconstrictor. So if you have diabetes, if you have signs of peripheral vascular disease, and you continue to smoke, you're just making things worse. And so you will end up with amputations. And I'm a big proponent of those lifestyle changes, because amputations now in podiatry, we don't want amputation, because when you amputate it, then we're out of a job.
Yeah, no, that's well stated. We're having a little fun in the chat, so you see some of my colleagues laughing there. But yeah, I think those are great points, especially, the hair on the toes and various things. But, we don't pay attention to a lot of those small things. And certainly, self-examination is really important. Really, the first examination, I've given talks in the past where I've said this, and I'll say that the most sensitive diagnostic and therapeutic tool in medicine in the future will be the meal plate. That's your breakfast, lunch, and dinner plate. And if you're consuming food that predisposes to peripheral arterial disease, then you're going to be in bad shape from the standpoint of being at risk for these diseases, whether it's coronary disease or peripheral arterial disease or cerebral vascular disease. When they did studies on autopsy teenagers, ages say 14 to 16, they found about 65%. And these are teenagers who died from cardiovascular, not from car accidents or traumatic injury. When they look in the blood vessels, primarily in the heart and periphery, they see early signs of atherosclerosis at about 65%. When you get to the age of 22, based on studies done in the mid-50s in the Korean War soldiers, it's close to 80%, about 77, 78%. So you can only imagine when you get to 30, 40, and 50 years old, the prevalence of atherosclerotic disease is going to be very high. And so if you're living a standard American lifestyle, then you're putting yourself at very high risk of having some level of disease. So in that setting, with some level of disease, you're going to very likely be in a situation where, it's only a matter of time or only a matter of event. And just keep in mind, as I alluded to earlier, you can have moderate disease where there are no problems when you are, say, without any kind of increased stress. But let's say you injure your foot. Maybe you're in a car accident, or maybe you scrape your foot riding your bicycle or whatever. Then you have an injury where the body has to increase its ability to deliver oxygenated blood and the like to that extremity. In that situation, you're going to be in dire straits. So that's the stress that's going to be brought onto your system, where you have to have an amputation, maybe because the foot doesn't heal, the ulcer doesn't heal, or you may have to undergo revascularization emergency because the ulcer foot doesn't heal. And we see that a lot with diabetics. That's what diabetics are told to wear shoes all the time. They have peripheral neuropathies. They may not feel the tack or the nail or the rock, so they injure their foot and it gets infected. And the next thing you know, they have a gangrenous toe when, one point they felt good, the next point they have a gangrenous toe, and then they have to have advanced surgery. So be mindful before you get to that point and look at the lifestyle. If you're eating standard American diet, you're not getting out, you're not exercising, you're consuming some of the worst foods, and you have a family history of these things, then you're very likely have the disease. It just haven't manifested to the point where somebody wants to give you a pill or start a procedure. Any other thoughts from the gallery here? I think we all...
I wanted to say something. So claudication, we talked about it, is having the leg pain when we're walking. Many people don't realize, but we talked about that word, but I didn't know if the audience was familiar with it. But walking a distance and developing discomfort, usually it's in the calves and having to stop. That's a sign, that can be a sign of peripheral vascular disease. And this lady that we talked about, this patient, she seemed to be just a poster child for lifestyle and diet. Everything was wrong. The smoking was wrong. She's already had coronary artery disease and the bypass. And I think we don't, as physicians and practitioners, we don't impress enough on how important the diet is, because I'm sure her diet was very unrestricted with animal products, as you said, Baxter, and fried food and battered food and highly high carbohydrates, probably soda, sugary beverages and of that nature, but it was unrestricted, and that really was narrowing her blood vessels and causing more plaque and narrowing in her blood vessels. When it's early, when we have peripheral artery disease and it's early, walking is good because it can create collaterals, like where we're creating a bypass there, and the circulation can get around those blockages when it's early. So that's why you emphasize the walking and when we can. But sometimes there's other limitations. But I tell people about smoking. I say, everybody that has an amputation is not a diabetic, but smoking definitely can increase the risk for amputation and losing toes, feet, and legs. And I tell people that smoke, imagine yourself without a leg or a foot, every time you smoke. And, perhaps that has some impact in thinking about it, because most people would not want to be in a wheelchair without a leg or a foot. So, that we have to kind of visualize that.
Yeah, I think you're right. And I like your comments about her being the poster child for bad lifestyle. I mean, and I don't know, and we see these people all the time. I mean, they come in and they've had all these issues, and I don't know, I would imagine someone's talked to them. I'm sure somebody may have whispered, stop smoking or whatever, but I get a sense that the emphasis is not placed on that. And I get a sense, you can look at this article. I mean, just look at this article. And we see from this article that that there's little to no emphasis on this lady making lifestyle changes. And even when they talk about their management, they talk about the drugs they're going to give. Of course, they do the Doppler studies, et cetera, but there's no discussion of intense counseling in terms of what you need to do. And this is a shortcoming, I think, in our medical approach to things. I mean, the New England Journal is one of the prominent medical journals. I mean, this is supposed to be the best of the best. This is the creme de la creme of medical treatment for somebody with advanced coronary disease, advanced peripheral disease. And I'm sad to say I give them a D. They mentioned lifestyle once, but I think that's a very poor management. I'm not saying that these drugs haven't had any scientific evidence, but this patient has systemic vascular disease. Just saying for coaching on smoking is not enough. She needs to be told to stop immediately. She needs to be told that she needs to drastically change her diet. She needs to be put in an intense nutritional regimen. You need to control her food first and foremost intensely for a defined period of time. The evidence of this is shown in the medical literature. And so that's the type of intervention that this patient needs. That type of intervention not only has the benefit of the actual effects of the food itself, but it has an impact on the psychology of the patient in terms of making her understand that what she eats has to be extremely pristine extremely pure, and she must be very intentional about what she puts in her mouth, and more importantly, about what she excludes from putting in her mouth. And so that's the intervention that needs to be had, and in my opinion, is the first rate care. What's prescribed in this journal, not to be critical, is bush league medicine. I can't be more blunt than that, but it's not that revascularization medical therapy doesn't have a place, but these things need to be at the very end. And she should have been in some kind of an aggressive intervention 5 years ago, where she had a bypass 6 years ago when she had a heart attack and bypass surgery. All of this would have been, done away with. Tex Houston 7 asked about treating this with a Beamer. Dr. Floyd, do you want to talk about that, or you and Pam have a lot of experience with Beamer?
Yes, Beamer is an option, but at some point it just depends on where you are in the disease process. You want to, again, give yourself the best chance for Beamer to work, but Beamer is a good option for increasing microcirculation. I think doing even adding to that chelation therapy, chelating those arteriosclerotic plaques, which in the larger vessels and larger arterioles has to be addressed also. Beamer really helps the circulation to the tissues, and it definitely has a benefit there. But the diet and the lifestyle change, making those small adjustments are huge. One thing Dr. Pamela used to always say is, one of the earliest signs, especially in men, one of the earliest signs of cardiovascular disease or peripheral vascular disease is erectile dysfunction. So when we see young men in their early, late 30s, early 40s, and they're starting having erectile dysfunction issues, first thing you should do is call your cardiologist. You should look at your vascular, what's going on with your cardiac, because if those vessels are starting to clog up, then your coronary arteries can have problems, your peripheral arteries can have problems, and we can't leave out our brain because memory loss, confusion, those symptoms, because you still have that microcirculation in your brain that's there, because the arteriosclerotic plaques don't discriminate. They will go where they go.
Yeah, that's a great point. Erectile dysfunction is a form of peripheral vascular disease, and it can be considered a form of peripheral vascular disease because, like you say, those are like the so-called canary in the coal mine. But you mentioned chelation therapy. I was remiss in mentioning that. Chelation therapy, and as well as ECP therapy, can be beneficial for people with coronary disease and angina, but also peripheral arterial disease. And even the so-called mainstream allopathic medicine, they consider it a class 2B, both of them a class 2B indication for the treatment of people with intractable angina. And so I remember being at I think it's a ACC conference when, it was mentioned, and the presenter was saying, yeah, believe it or not, ECP and chelation therapy, the 2B, they're acting like it was something strange, but they're very effective therapy, and so it's also another option for this as well. Somebody mentioned getting calcium scores early is a good way of screening. This patient, it would apply to somebody with peripheral vascular disease, but who don't have a diagnosis of coronary disease. This patient already had a diagnosis of coronary disease, had bypass surgery. So I'm not sure if a calcium score would be helpful here, but certainly in the general sense it would be. So, anyway, so that's our take on this.
Yeah, one additional thing I want to mention about the Beamer, just to clarify, Beamer is more of a wellness tool for people who want to, you want to maintain, get some stability when it comes to diet, nutrition, lifestyle, but maintaining wellness, that means that you want to maintain your level of circulation throughout your body, that you want to promote healthy options, is how we use it. And I think is the most effective way to use it. It's not a cure-all where it's going to solve a problem. It can solve problems, but you want to use it as a way to maintain optimal health, to improve your health, improve circulation, because that's what aging. I think the biggest issue with aging or getting old is a reduced circulation over time. So the more your circulation reduces over time, the more symptoms and problems and conditions that we put diagnosis codes on or labels on, we tend to have. So, Beamer is a good tool for that, and that's kind of how it's the most effective way to be used.
Yep. I agree.
For pediatrics, because I think sometimes, when we talk about topics like this, we don't think of it as being pertinent for the children. But as you mentioned, Dr. Montgomery, when they've done autopsies on children who've had accidents, they found evidence of atherosclerosis in these children. And so, especially now, I think it's important that we take heed to this, because we're seeing more children with high blood pressure. Now we can change their lifestyle in just a little bit and it will come down, but it's very common now for me to see children come in and their blood pressure is elevated. And it's not just from being nervous at the doctor's office, because it's multiple visits that the blood pressure is elevated. And that's usually in the teenagers. And also, as we've talked about before, their lipid panels are also elevated, which didn't happen so much about 10 years ago. But now, as our standard American diet changes, those numbers are also elevating. So, the children are really close in line to having issues a lot earlier in life. I mean, in this example, this lady is 50, 60 when she had this second event. But, if we keep moving in the direction that we're going to start seeing these episodes a lot earlier, because as Dr. Atkins said, most people can do well because they'll form collaterals. And I think that's why children do well, even though some of the vessels are narrowed and blocked. They still run. Children run everywhere, and that's a good thing. So they keep those collaterals going. But as they get older and are not as active, and also they've probably used up all the space, now we start running into roadblocks, and we'll start seeing some issues. It may present differently, but same thing, cardiovascular disease on some level in younger people, I feel, unfortunately, is coming if we don't start emphasizing lifestyle changes earlier.
Yeah, I think that's right on. And we really, these diseases do start in kids, even though, like you say, they have, some reserve and they don't manifest symptoms as early. But, these are diseases of the children. They just manifest when they're older adults. And it's something that, again, it starts with the lifestyle. And at some point, the mainstream medical community maybe will wake up to the fact that lifestyle needs to be the emphasis of this. That needs to be bold. It's the main intervention. It's the main intervention early on. It's the main intervention even when you have symptoms. And even in the acute setting, we presented even on this channel how lifestyle intervention, even with somebody who has to have emergent surgery, et cetera, has the potential to improve outcomes, even in the OR, the ICU, the ER, et cetera. So these aggressive nutritional interventions can have an impact, and should be the emphasis at every point, whether it's the primary emphasis or co-emphasis of another emergent intervention. It needs to be a big part of the intervention. And at some point, we will wake up to this. I don't know when, maybe another 100 years, but anyway. But thanks, guys. It's been a great show as usual. It's good to have the whole team back. I think it's the first time we had the whole team back. So I never took all the pictures out. So I figure we'd all be back at some point. But anyway, thanks for being here, and I look forward to seeing you guys next week. We'll be talking about atrial fibrillation next week. I'll post that show, and then I'll see you guys backstage, and then we'll talk about other shows. So I'll see you backstage in a couple of minutes. Well, again, everybody, we have another, discussion on, a health condition that really should be treated with lifestyle intervention. And I really think that it's something that we should take to heart. This is just one health condition, but as you can tell from the article, from the presentation, it's linked to other health conditions, other cardiovascular events. It's related to cardiovascular disease, heart attack, and stroke. It's also related to diabetes and high blood pressure. It's also related to obesity and other metabolic problems such as diabetes. So the body's intertwined, and these metabolic diseases are really all one health condition that's a problem. So we have to be mindful of that. And really, there's a fundamental solution that needs to be considered. And that, of course, is your lifestyle. So again, thank you for joining us tonight. And again, give us a thumbs up if you like what you saw. Please take time to subscribe. And of course, share this with friends, with loved ones, or just share it in general. And don't forget to hit the notification button so you can hear about future stories. Until next time, keep it fresh, natural, and live.